Welcome to the presentation COVID-19 and Long-Term Care prepared by the Office of the State Long-Term Care Ombudsman. I will be sharing information with you about the many changes that have occurred since the virus was first detected in our country earlier this year. I'll begin by trying to explain just what the COVID-19 is. It is a new virus that is currently found in many countries worldwide. And because it is new, doctors and scientists are learning more about it every day. It is highly contagious and very easily spread, especially in areas where there are groups of people found in close proximity to each other. It leads to a respiratory illness, and the symptoms vary from one individual to the next. Symptoms include cough, fever, shortness of breath, chills, muscle pain, headache, sore throat, and sometimes shaking with chills. This list may not be all-inclusive as new symptoms continue to appear. Some people report losing their sense of smell and taste with the virus. While researchers are working tirelessly to develop a vaccine for this illness, there is currently not a vaccine available at this time. The illness has affected people of all ages. However, it is very serious and can be life-threatening in people over the age of 60 or people with underlying health conditions. In people over the age of 80, the virus can be very deadly. What are the responsibilities of the Long-Term Care Ombudsman? The Older Americans Act mandates that each state have an office of the Long-Term Care Ombudsman. Our mission is to protect the health, welfare, and rights of individuals residing in long-term care facilities such as nursing homes, assisted living facilities, residential care facilities, and elder group homes. In Iowa, the State Long-Term Care Ombudsman is located in Des Moines, and there are 6 local long-term care ombudsmen located throughout the state. We have a volunteer ombudsman coordinator who is responsible for recruiting people to become certified volunteer ombudsmen and who are also trained to advocate on behalf of everyone living in long-term care facilities. We also have managed care ombudsmen who advocate for managed care members who receive care in Iowa's healthcare facilities, as well as members who are enrolled in any of the home and community-based services waiver programs. The goal of the Long-Term Care Ombudsman program is to enhance the resident and tenant's quality of life by investigating complaints, seeking resolutions to problems, and providing advocacy on their behalf. We work to protect the rights of residents and tenants living in Iowa's long-term care facilities. We are also available to answer questions regarding long-term care rules and rights. So how do we advocate during the COVID-19 crisis? We continue to advocate for residents and tenants living in Iowa's long-term care facilities. However, our methods and ability to meet with residents and tenants in person has changed since COVID-19 entered our country earlier this year. We continue to advocate and will do so through visits, by phone, technology such as Zoom, FaceTime, Skype, by email, and regular mail. We proceed with concerns that the residents' direction and our services are free and confidential. Changes you are seeing related to COVID-19. As the country began to see more cases of COVID-19 surfacing earlier this year, the federal and state governments implemented many rule changes for nursing homes. These changes were made in an effort to keep all residents safe. The rules are changing very quickly, and our office is available to answer the questions you may have regarding the many changes that have occurred and are continuing to occur. Keeping residents safe is the goal of many of the rule changes. The rule changes have been made in an effort to prevent the spread of the virus in community settings. Again, please contact the Office of the State Long-Term Care Ombudsman with any questions or concerns you may have, especially related to the recent rule changes. So what are some of the rule changes impacting you as a resident of a long-term care facility? Please keep in mind that the nursing facilities are following guidelines that have been developed with many federal and state agencies working together in an attempt to keep everyone safe. The Centers for Medicare and Medicaid Services, or CMS, is working closely with the Centers for Disease Control and public health departments in formulating these new guidelines. One of the earliest restrictions and guidelines that residents felt the most impact from was in regard to visitors. One of the earliest changes was the restrictions of visitors unless in a compassionate care situation such as the end of life, and only if they show no signs or symptoms of COVID-19. Each person entering the building must be screened by having their temperature checked and answering a series of questions. Non-essential healthcare workers are restricted, as are long-term care ombudsman and representatives of the office. Residents may be seeing medical providers via telehealth in an effort to try to limit the number of people entering the nursing facilities. There is now one point of entry at the nursing homes, and deliveries must be left at the door or an outside location. Staff and residents are also screened daily and throughout the day for any signs and symptoms of COVID-19. How can you visit with families during this time? Nursing home staff and family members have had to become very creative in figuring out ways to visit with their loved ones during this time of COVID-19. Many facilities have purchased electronic tablets and devices so that family members and residents can visit by FaceTime, Skype, and Zoom meetings. Facilities are encouraging the use of phone calls, text messages, and emails. Letter writing is also encouraged in an effort to maintain contact and some sense of normalcy. When possible, visits are done at the resident's window through the use of cell phones. There are also computer apps where video greetings can be recorded, such as WhatsApp and Marco Polo. There is no substitute for an in-person visit from a loved one, but everyone is trying to find new ways of doing everyday tasks during this pandemic. There have been many new terms that have been developed since the arrival of COVID-19, and one of them is social distancing. Social distancing has been proven to be effective in helping stop the spread of COVID-19. So what exactly is social distancing? Social distancing requires that people maintain a distance of 6 feet apart for the majority of the time or whenever possible. Social distancing does not allow groups larger than 10 to gather and prevents mass gatherings. Many church services and public events have been canceled or postponed so that social distancing may occur to keep people safe. Church services have been allowed to resume under Governor Kim Reynolds' plan to attempt to reopen the state. However, many churches have chosen to continue online services for now. Residents have been instructed to follow the guidelines of social distancing, which is why many of you are being asked to eat meals in your rooms. If the dining rooms are being used, there may be only 1 or 2 residents at a table so that good social distancing guidelines can be followed. Residents are now being offered activities in their rooms, at their doorways, or in very small groups while keeping at least 6 feet apart. It is also vitally important that everyone practice good hand hygiene at all times by washing your hands frequently, using hand sanitizer when available, and by not touching your face. In an effort to provide isolation rooms and even wings or hallways, residents may be asked to change rooms, and many of the restrictions have been waived related to this. Nursing facilities are not currently required to give a 48-hour notice prior to a room change, and you may not have a choice of roommate in this situation. The new rules require that any new resident or a resident returning from the hospital must be isolated for 14 days in an effort to self-quarantine. It is because of this that residents are being asked to move to other rooms in the building. At this time, residents may not refuse the transfer and may have to share a room with another resident without giving both of their consent. The hope is that these temporary changes will prevent the spread of the COVID-19 virus in nursing facilities, and residents will definitely feel the impact of this change. Many of the regulations related to discharge or facility-to-facility transfers have been waived during the pandemic. Some states have opened facilities that are dedicated to caring strictly for residents who test positive for COVID-19, and these transfers may not be refused, and the usual transfer requirements may not apply. These situations may occur requiring a transfer to another facility and will only happen under these situations. Cohort facilities must agree to accept the resident, and advance notice is not required. The rules regarding repurposing rooms in nursing homes have also changed during the pandemic. Activity rooms, meeting and conference rooms, dining rooms may be used for other purposes as long as residents can be kept safe and comfortable. And in these situations, there are no requirements for prior approval. So what can the staff do to prevent the spread of COVID-19? Many steps are being taken in nursing facilities to attempt to prevent the virus from entering the building or stopping the spread. Each nursing facility is required to do a self-assessment of its infection control policies to determine how well equipped they are to handle the spread of infection. Residents and family members can ask for a copy of this assessment. The staff at nursing facilities are now required to wear personal protective equipment, or PPE, such as gloves, gowns, masks, and face shields. The staff are required to wash their hands or use hand sanitizer before and after each contact with residents and after removing their personal protective equipment. There should be hand sanitizer readily available throughout the building, preferably in and outside of resident rooms. Certain areas of the facility and commonly touched areas are to be disinfected at least daily. The staff should always cover their coughs by coughing into their elbows, should not work when they are sick, and must disinfect any medical equipment that is used between residents. 5 steps to good hand hygiene. Hand washing is something that we have done from a very young age, but we are finding that we may not have been doing this correctly. So here are some steps to good hand hygiene. Begin by wetting your hands with clean running water, which can be warm or cold. After your hands are wet, turn the faucet off and apply soap. Lather your hands by rubbing them together with the soap, making sure to lather the backs of your hands, between your fingers, including your thumbs and under fingernails. This should be done for at least 20 seconds or in the time it takes to sing happy birthday 2 times. Rinse your hands thoroughly and use a paper towel to turn off the faucet. So how are staff being monitored? Any staff who has signs and symptoms of a respiratory infection should not report to work and must stay home. If a staff member develops any signs and symptoms of a respiratory infection while at work, they should immediately stop working. Inform the nursing home's infection control nurse of any individuals, equipment, and locations that the affected person came in contact with, and contact the local public health department for the next steps, which may include being tested for the virus. the infected staff member must stay at home. Testing is being done to people who display signs and symptoms, but this criteria may change as more testing kits become available. Do you need to be hospitalized if you test positive for COVID-19? At this time, only residents with severe symptoms should be hospitalized, and the severity of symptoms varies with each person. Some people have only mild symptoms and recover with no interventions other than staying at home in isolation. As we learn more about this illness, doctors are discovering that some people may not display any symptoms and test positive for the illness. Most people are able to recover with little medical intervention and do not require a hospitalization. As long as the nursing facility can practice the infection prevention and control practices recommended for caring with a resident with COVID-19, they do not need to go to the hospital. The nursing staff is working very closely with the local hospital, county and state public health, and is following their guidelines and recommendations. The nursing home staff is required to report to the residents and their responsible parties within 12 hours of the occurrence of a single confirmed infection of COVID-19, or 3 or more residents or staff with new onset of respiratory symptoms that occur within 72 hours. Updates must be provided weekly or each time a confirmed infection is identified, or whenever 3 or more residents or staff with new onset of respiratory symptoms occurs within 72 hours. The reports adhere to existing privacy regulation and statutes. Can a nursing home accept a person who tests positive for COVID-19? A nursing home can accept new residents who test positive for COVID-19 as long as they can follow the transmission-based precautions. Current residents who test positive can usually remain in the facility when the proper steps are taken to prevent the spread of the virus. Any new resident entering the facility or a current resident returning from the hospital is moved to an isolation room or wing for 14 days. Specific staff are dedicated to working with these residents and are discouraged from going between the isolation area and other parts of the building. Staff are also discouraged from working at different locations and buildings during this time. Working together during this time. Now more than ever, it is important to promote good communication between the residents, family members, staff, and the Long-Term Care Ombudsman. Some things that residents can do to stay safe is to make sure that staff wash their hands or use hand sanitizer before and after providing cares and when removing protective gloves or other PPE. Report to the Director of Nursing or the administrator any staff who appears to be sick while working, and we all need to practice good hand hygiene. Everyone should cough into their elbows or sleeves, and we all need to ask for assistance in contacting our loved ones as desired. Resident rights continue to be the focus of the Long-Term Care Ombudsman. You still have the right to the care and services you have always been entitled to. You have the right to participate in your care plan, which must be person-centered. You have the right to be free from abuse, neglect, exploitation, and misappropriation of your property. You have the right to voice grievances without discrimination or retaliation or the fear of it, and expect prompt efforts by the facility to resolve any grievances. These are just a few of the resident rights, so please contact the Office of the State Long-Term Care Ombudsman in the event that you have additional questions. Is there any good news to come from all of the information about COVID-19? The good news is that some residents of long-term care facilities may be receiving stimulus checks from the Internal Revenue Service in response to COVID-19. All stimulus payments must be reported to the Department of Human Services as income. Stimulus payments to individuals are not countable income for Medicaid applicants and recipients. Additionally, stimulus payments not spent in the month it is received are excluded as a resource for 12 months. The stimulus payment is not taxable income, but a fully refundable advance tax credit. Client participation is the amount of income that an individual must pay to the long-term care facility monthly for their care. The stimulus payment will not be counted as income subject to client participation as it relates to Medicaid. The money you receive as a stimulus check is yours to spend as needed or as you deem appropriate. Please contact the Department of Human Services if you have any questions. Our office may be contacted toll-free by calling 1-866-236-1430, and please remember that all telephone calls are confidential. This concludes the presentation on COVID-19 and long-term care facilities.